there, welcome to Chapter 10 for Microbiology, Intro to Microbiology. And what Chapter 10 is looking at is host-microbe interactions and then some pathogenicity. And with the host-microbe interactions, you need to remember, as we've talked about really all the way through this semester, is how we have, as a host, microbes living on us at all times. And so there has to be a proper balance, all right, to make sure everything is happy and acceptable. And so most of these interactions are good. However, there can be situations where those host microbe interactions are negative, and so you would have disease. Typically, when you have those negative interactions, it's going to involve pathogenicity, all right? The opportunity for an organism to be pathogenic, to cause disease. Here you have Figure 1 in Chapter 10 that looks at the fact that these host microbe interactions can be benign or cause disease, all right? And in box 1 there, you have all of the normal microbiota. All right, you have this nice array of bacteria here and other organisms, some fungal, yeast primarily, and possibly even some protozoa. But when and this is looking specifically at the gut, all right, your GI tract. Your GI tract has a lot of different microbes in it, and under normal circumstances, they live in symbiosis. They live in a balance situation. And what this figure is showing is this person goes into the hospital for some reason, possibly pneumonia. All right, but it has nothing to do with the person's GI tract. So all of these microbes are living in this person's GI tract, and that's a healthy scenario. But the person has a disease in which bacteria have gotten down into the lungs, which should normally be a sterile place. No microbes living there, no normal flora. And so what happens? Well, the person goes on antibiotic therapy. And that antibiotic therapy is supposed to get rid of the bacteria that's in the person's lungs, which it can do relatively easily. However, now look at the picture of the GI tract, all right? A lot of the bacteria from the healthy environment has now been taken out. Why? Because the antibiotics aren't just going to target the bacteria that are in the lungs, they're going to target the bacteria everywhere in that person's body that are susceptible to the particular antibiotic. All right, so then what happens in this case? All right, possibly nothing. All right, now you have fewer microbes, but in the right setting, then these microbes could grow back after the person went off antibiotics and life would be fine. Well, this person is in the hospital, and unfortunately, there can be a lot of inadvertent transmission. All right, so now you have the healthcare worker provider who has Clostridium difficile on his or her hands, touches the patient, and now this patient gets contaminated with the C. diff. Now, C. diff is pathogenic, all right, in almost every case. There's the idea that some individuals may actually have a small amount of C. diff in their gut, and that bacteria is held at very low numbers, and in low numbers, it's not pathogenic. But here, if this person gets contaminated, inoculated with, say, C. diff up here, there's a lot of room here. And so that C. diff can get into this area and basically have a party. Brand new scenario, lots of nutrients, lots of space, and it grows up at high number. And that's what box 4 here represents, is what's called dysbiosis. All right, the normal circumstances are out of whack, and you have this microbiota imbalance. The microbes here are winning, all right? You don't have this nice balanced scenario. Microbes are winning, puts this person at risk, and this could be a very, very negative situation. Okay, individuals will die because of C. diff infection. They go into the hospital for pneumonia. They die from severe intestinal issues. All right, this Clostridium difficile infection produces what's called megacolon pseudomembrane colitis. It is a very nasty way to have to die by. All right, but most of your normal flora, all right, the normal microbiota, are fine for you. However, differences in host factors, all right, the different hosts. A harmless species of a normal flora for one host may actually be pathogenic in another. All right, so not everyone is created equal in the eyes of bacteria, and that could be for a variety of reasons. It could be for age and how healthy the person's immune system is, how mature their immune system is. It could be due to stress. It could be to other underlying health scenarios. How healthy is the person in general? All right, but the example given here is group B streptococcus. All right, so sometimes referred to as beta strep, but in this case just GBS for group B strep. And with group B strep, it's estimated that 30%, and this number is actually higher than what I've seen. I've normally seen more like 15 to 20%, but here, 15 to 30% of women harbor group B strep as normal commensals, normal flora in the vagina. And under normal circumstances, that's not a problem for them. All right? It's in that one location. The bacteria are fine with that. The rest of the bacteria in that area are fine, and it really is an okay situation. However, introducing that group B strep into newborns, all right, newborns, infants being born vaginally, they get inoculated with any bacteria that are in the mom's vagina, and under normal circumstances, that's fine. That's how the infant begins to develop their own normal flora, is through that birthing process. Unfortunately, group B strep, fine in the mom, is deadly, can be deadly in the newborn. And what it ends up with is sepsis, right, with the bacteria getting into the newborn and actually getting into the blood and being able to grow and expand. It can cause meningitis, and the meningitis is really the big one. I mean, sepsis is bad, but with meningitis, this used to be the #1 cause for death in newborns, infants under the age of a month, because the bacteria, the group B strep, gets inoculated into the infant's mouth, the nose, the eyes, the ears, and it's very close proximity to their brain. And unfortunately, many, many, many children, infants, died before doctors realized what was going on. And then it can also cause pneumonia. And of course, sepsis, pneumonia can be a major issue for an infant. Their system is, for a newborn, right? Their system is brand new. They don't have normal flora. That bacteria can get into them, and even though they're an infant, they're tiny. That tiny body is still a huge incubator for those bacteria, and they can expand to very high numbers and make that infant extremely ill. And so now how do we treat that, or how do we look for it? All right, pregnant women are screened for group B strep. So usually, I don't know, maybe month 6 in the pregnancy, 6 or 7, the mom is screened for group B strep, and so the doctor knows whether or not group B strep is part of her normal flora. And so what happens then? Well, right now, what used to happen, and it's debated right now what's the best way to get around this scenario, is that once the mom went into labor and went into the hospital, the mom would instantly get put on IV antibiotics. Now, why is that? Well, it's not to protect the mom, but rather the infant is still inside of her, attached to her blood flow. And so putting the antibiotics into the mom's bloodstream, as long as the mom was in the hospital and got 2 IV doses of the antibiotics, then it was thought that that is plenty of antibiotic to actually move through the infant, such that the infant has then high enough levels of antibiotic that when they were exposed to that group B strep, if any of that got into their system, the antibiotics would be there to clear it out. All right, well, with the antibiotics, again, as you saw from that previous picture, the antibiotics don't just target the group B strep, right? It targets everything else. And so that does actually alter how the infant's microflora begins, right? Begins to form. And so I believe that there are now doctors who will screen the moms for group B strep, and instead of actually putting the infant or the mom on antibiotics, and sometimes if that labor happens very quickly, then the infant would actually go on IV antibiotics. But rather, they may not use antibiotics anymore and just closely watch that infant, right? If the infant starts running any kind of fever, no matter how low, they would automatically put that infant on antibiotics because they would worry that that group B strep actually is trying to cause a problem. All right, so that's the example of the opportunistic pathogen. In one place it's fine, but put into the right, given the opportunity, under certain circumstances, it can cause infection. All right. Here you have also E. coli in the appendix, enters the abdominal cavity, causes inflammation. Weakened immune systems allow for yeast infections. So, almost any microbe that we have can actually become a pathogen if it is given the right opportunity. All right, so we may have looked at these terms in chapter 9, possibly, but pathogenicity is the ability of a microbe to cause disease. How pathogenic is it? Is it high? Is it low? And then virulence describes the degree of extent of disease that a pathogen causes. And then virulence factors. What factors do the pathogen have to overcome the immune system, right, our defenses, that will then allow the bacteria to actually be virulent and pathogenic. All right, so here are some of, this is a good figure to look at for a good synopsis of some of these interactions that will influence whether or not a microbe is virulent. All right, so here we have the pathogen. And first off, there's adhesion factors, all right, fimbriae, binding proteins, pili. Those will allow the bacteria to bind to the host. I mentioned this with urinary tract infections. All right, the fimbriae will actually allow the bacteria to tightly secure itself to a host cell, and then it doesn't get moved out quickly. Nutrient acquisition. All right, this really is a good summary of the entire chapter, or about half the chapter. How can the bacteria work to grab the nutrients it needs and actually pull them away from the host? All right, invasion. How easy is it for the microbe to actually invade the human host? All right, so there's enzymes it can produce to help that process. Flagella, can it move? And then immune system evasion, we won't talk about this a lot here, but the bacteria can actually evade the immune system, be able to hide from it. And so then it doesn't get cleared and it's able to expand. And then toxins. All right, what kind of toxins can the microbe secrete to actually cause more damage once it's in the host? All right, so the rest of the chapter will be looking at that. All right, so classic virulence factors include the pathogen toxicity. How toxic is it? How aggressive is it? How easy is it to transmit from one person to the next? Whether or not it's virulent. All right. And it's interesting how pathogens can also develop new virulence factors in response to the host, as well as pressures that it finds inside of the host.